You Badge Club members have the best questions, and this one is like a really, really tricky one. So I totally appreciate it. Hi, I'm your local OBGYN. I love women. And what are you supposed to do if you are more than 10 years from menopause or over the age of 60, kind of like whichever one comes first, depending on how you read the previous recommendations and discussions on HRT? Like, are you out of luck? Are you done? Is it a definite no? So, in medicine, here's what I'm going to say. There's never an always, and there's never a never. So if that makes sense, it doesn't. You should never say always or never, but I started that statement with never. So the deal is that when you are more than 10 years outside of menopause, or theoretically over the age of 60, although I kind of think that's a softer number depending on menopause onset, there's sort of this tipping point where starting HRT, like estrogen and progesterone, has benefit for your cardiovascular health. But when you kind of get to that tipping point and beyond, either there's no effect or some of the studies suggest that there could be an increased risk, meaning heart disease or like a cerebrovascular accident or something along the line that could cause an earlier potential all-cause mortality. Now, it's a little bit vague. It's probably not studied as thoroughly as it should, because once they did the study in the WHI and they saw that this was a risk factor, they just kind of like ended it there and they followed it a little bit. I think that it's a very personal decision. I think that everybody needs to kind of like look at this, look at themselves, look at their risk factors. And if somebody is well versed and well counseled, I think that it's something that you can consider. You can't go in blindly. You don't want to just assume, hey, it's going to be fine. You need to know that there's some numbers that we have to tell you that are risk factors, because nothing is all good and nothing is all bad. If you really think it's for you, I think that there's value in having the conversation and getting all the plus minuses to decide what works for you.